Hi, and welcome everybody, and welcome David. Thank you for doing this webinar today. If you haven't had the chance to learn of David, I highly recommend it. I went on the course briefly last year, and I only managed to be there for the first 3 hours because I was just there really for admin and opening up and introducing people, etc. But it was absolutely within 3 hours I realized I was missing out on something massive, and David puts the information across so well. I'm coming to this course this time. I don't want to miss it again this time. So I will be there with my notebook and eager to learn. So thank you very much for doing this. And we've got I've put in the chat already a link to a course in June that's being run and a discount offer on there as well for AAC members, which is about £80 off. And we can go through the dates at the end of the course, etc. Okay, a few more coming through now. Great. I'll hand over to David, and away we go.
Hi, so good evening, everyone. So thank you, Chris, for introducing me. It was also great meeting you in Macclesfield a year ago.
Indeed.
So this evening, because it's evening time, we're not going to go into too much depth. We're not going to speak about points and what points or certain. I might give you a few points that you can use in your clinic, but mainly the idea of the principle of what we're trying to do, especially that the principle is very important, because if you follow the principle, then you can already start doing amazing things with acupuncture yourself on patients that are undergoing neurorehabilitation with a motor function disorder, even a sensory function disorder. So the principle is very important. I've been working for over 13, 14 years in a neurorehabilitational center in Israel, one of the largest centers here in north of Israel, in a hospital, a Western facility, where we've actually, throughout the years, been combining the idea of scalp acupuncture with its advantages on patients undergoing neurorehabilitation. So I would see patients that have suffered maybe that had a stroke, or patients that have had back surgery that's gone bad, or neck surgery that's gone bad, or Parkinson's patients, multiple sclerosis patients. So a vast clinic of a lot of different types of patients. So what I want to bring here is actually the principle. And I remember what is the biggest difference between what I started out 14 years ago to what I started out today was, as a young practitioner then, I was a few years into the field already, but I was still a young practitioner, but I believed I'm going to make a big change. And especially in neurorehabilitation, I saw the results of scalp acupuncture. I said, okay, this is going to work, and we're going to have amazing results. But slowly, as the years progressed, and as I matured into the topic, into the subject of neurorehabilitation, I started understanding that acupuncture, especially speaking about the scalp acupuncture, is just it's one part of a large multi-system treatment to actually rehabilitate the patient as best as possible. And that's what I want to bring here. So you can understand it, because there's a lot of variety. There's a lot of things you have to take into account when you want to apply the acupuncture, no matter if it's scalp acupuncture or body acupuncture, any type of technique to stimulate the nerve system. So one of the things is I like to mention it that scalp acupuncture, Professor Zhu, there's many techniques today of scalp acupuncture. There's Zhu style scalp acupuncture, there's Yamamoto style, which that's what we are mainly going to cover in the first 2 days of the webinar of this course. We actually, in the first 3 days, where we actually going to go deeper instead of going on a large scale and learning the whole technique, we'll go deeper into the technique. We'll palpate. Avi and I that will teaching with me will come by, make sure you're palpating correctly, the correct points, but also the principles. Will go deeper into the idea of principles, how you can bring it into your clinic and get very good results. So, and like I said, there's many techniques, there's many courses around of scalp acupuncture. What makes us unique, we try to bring our clinical practice, Avi's clinical practice into the clinic. Avi works in neurosurgery and I work in rehabilitation. So he sees some patients before and I see them afterwards, but in two different hospitals. But a lot of times we have a lot of communication one with each other. So it makes it great for the patient. So first thing I'm going very, very simply, simple idea is the idea of that our brain, or you could say our nerve system, we have the peripheral nerve system, we have the central nerve system. The biggest difference between them is whatever in the brain areas, cerebrum, cerebellum, brainstem area, the spinal cord, all that's got to do with the central nerve system. And what's out of there is more the peripheral nerve system. And then we have also the cranial nerves that originate from the brainstem and go and innervate certain areas of the body. So what is constantly happening, first of all, the way the brain works is, first of all, the first thing it does is perceives information. So at every given moment, your nerve system is telling you a story. Okay? Telling you a story. It could be a positive story, could be a negative story, but it could also influence your motor function. It can influence your mental state. It can influence your sensory stimulation. But the idea is that you want to get as much oriented information going to the brain as possible, and you want the brain to, and then the next stage the brain does is it starts analyzing it. So think about it, that if the input to the brain is something is off or it's not correct, then the brain's going to analyze it incorrectly. So you want to make it as optimal as possible. So, and working with that. So think if you have a certain area that's damaged, and for example, you might have a problem with the sensory stimuli for your hand. Let's say you had a stroke. So think that you're not having any sensory stimuli input coming from that area. So of course, you're not going to be acknowledging it. So then there's two principles. You use it or lose it. That's one principle. The next principle is what wires together, fires together. These are two things we have to think about when we treat in a patient. So you have to think about, we want to optimize the information as best as possible. And one of the nicest things I heard from Professor Zhu, that I studied from Professor Zhu, was, which I like the sentence. He always says that scalp acupuncture, it's like unlocking the lock to the door. Each one has a different key, a different lock, or the lock's being damaged. And actually by using the scalp acupuncture, we're actually unlocking the door. So what I feel that actually what we do in the scalp acupuncture, what do I mean that unlocking the door, is actually allowing nerves or synaptic areas to start reconnecting with each other, or having an influence on the chemicals and making new neurons or new synaptic connections. And then by doing so, we want to overlap the areas that have been damaged. Okay, so that's what I believe we do in scalp acupuncture, or in acupuncture itself. Another thing is that when we come into the idea of the response, once we've got the input, we've analyzed the information, then we respond to this information, and that's a motor function. Motor function can be a movement of a hand, foot, a limb, any limb, but also can be a secretion of saliva, can be a secretion of a hormone or stimulating hormone, but that's a motor function that goes out, goes to the peripheral nerve system, and then we have an action. That's just in large what we're speaking about. But coming into the idea quickly, what's also important is brain health. There's a lot of exercises you need to sometimes to try and avoid a neurological problem. And another thing could be also when you have a neurological problem, how to motivate them and how to get them into the brain function as best as possible. So there's a lot of things we can do. One of them is sleep is important, to sleep correct hours, a few hours today. A lot of research is going into that. People that have impure sleeping, or you even have sleep apnea, might in the future cause some any disease. Okay, could be diabetes, and it also could be a stroke in the future. Meditation to relax the mind, to try and stimulate the mind. Social engagement is very, very important. This is very important. Social engagement is one of the things that is very, very important in when you're trying to recover the brain as well. And one of the reasons is because you constantly stimulating the brain. That's what you want to do. You want to constantly stimulate the brain. So when you're in interaction with someone and he's speaking back to you, straight away have to respond. It might take you, if you have a stroke, for example, it might take time, but it's slowly working on it will improve your outcome. Another thing that you have to take into account, the patients that have undergone, for example, a stroke, after they've had a stroke and they finish the rehabilitation, and it's that paralysis for the hand, for the left hand, a lot of them start deteriorating. One of the reasons sometimes they deteriorate, even though they're doing well in the rehabilitation, they had a positive outcome, is the reason because they start seclude themselves. They don't want to be seen in public because they're kind of embarrassed. My hand is paralyzed, you don't want people to look at you. And slowly they seclude themselves into the home, and slowly all their mental state starts degenerating, and also the brain starts degenerating. Okay, nutrition, they speak a lot about the idea of nutrition. The brain works basically has two energy sources. One of them is what we use mostly, especially in Western nutrition. It's because of all the processed food that a lot of us are eating, or we less and less cook at home, but even the ingredients we're cooking are not very good ingredients, for example. So we're using a lot of sugar or glucose. That's one state of energy, and that's the main energy source that we use today on the brain. The second energy source that we use less is actually the idea of fat, which is also important. That's also energy cores that is very, very useful. Just for the idea of nutrition, if we take the idea of the keto diet, for example, the keto diet, which it's a low carb diet with no carbs. And if we go into a bit of the history, okay? So the idea of the keto diet started out in the 1930s, when what they started seeing is that patients that had seizures due to epilepsy, one of the way to calm the seizures down was actually to put them on a diet or fasting. And what happened when they were fasting, the seizures were less and less. But of course, you can't hold someone on a fasting for so long because you'll pass away. He needs the energy. So that was the way they started developing this idea of Hudson's nutrition, and then the idea of keto nutrition. Now, it's not that it's good for everyone, but just that general idea between the two types of energy source. The idea is what happens when you have a keto diet, just in general, that you have a ketosis. One of the things that when you have a ketosis, actually how it affects the immune system, the macrophages kind of kill off all the bad mitochondria in bad cells that are not working correctly, and allow the cells to regenerate themselves, or new mitochondria that are more effective. And this happens out throughout the body. So think what will happen in the brain if you have certain areas that have been damaged, and now you put them in this type of diet, you have a ketosis, and you have new areas or new mitochondria developing in these cells. So that's the idea of a keto diet between the two. The idea is to play around between them, what's called a keto flex, between keto flex diet, which is actually sometimes carbs, and then sometimes go on to a low carb diet or no carbs. And the idea is to play around with the two and to find exactly what's correct for you, for your patient, what works well. Just for example, keto diet not necessarily is very, very good for females. For example, it can impair their period. Okay? It can cause problems there, just in general. It's just it has an effect on the hormones. So just that general idea. But we're going into the idea of the brain. So the idea of nutrition of the brain, I'm gonna jump to what's more important for our topic today, is more the idea of neuroplasticity. And this is one of the first principles we need to understand that we're going to be working with. And why the idea of a neuroplasticity? Because if we go up to about 25 years ago, what was actually believed, that the brain, you have one function, one area, one function. And your brain develops in childhood to a certain age, to when you're adult, with adult life, or your later teens. And then what happens, your brain is very much established. And then you have one function you have one area that functions on one part of the brain as well. And if you have damage to that area, for example, you've actually lost that function. And that was what was believed. And actually, in the recent years, they've started to understand this idea of neuroplasticity, and to understand that actually your brain is constantly changing. And actually, what is also starting to develop more, that it's not that you have one function, you have certain areas that have maybe one function, or will have you function. For me, for example, to move my motor function, then I have certain areas of the brain that help in the idea of that motor function, the end of move my hand. So the brain is constantly, the idea of neuroplasticity is the brain has the ability to reorganize itself. And reorganize itself in a positive way, could be in a positive way, but also in a negative way, because you could develop a bad habit. And that's if we go into the idea of, for example, sometimes in anxiety, if you think that constantly your brain is telling yourself a story, and think that when you might have had some trauma in your childhood, and every time, for example, you see some different type of color, it triggers off something, but it actually triggers certain areas of the brain that might cause an anxiety attack, and you might not be aware of it. That's the negative part, and your brain is constantly telling the story in all the manners. And the same idea with the motor function. What's also important of the motor function, that actually in around the 1980s, they've done a research actually on apes. And what they wanted to do, they wanted to see how does this influence the motor function on the apes. And what the research, this is actually the first ground-breaking research or idea of neuroplasticity, how the brain can constantly change. And one of the things is that this researcher, I don't exactly remember the correct name. I do recommend to read the book, The Brain That Changes. Very, very good book, because it speaks about this idea of neuroplasticity and the pioneers of the neuroplasticity. And one of the stories there is exactly this, of a patient of these apes, that actually the researcher decided that's the first pioneer work, which was the breakthrough. He cut the sensory nerves of the apes in the one hand, and they had the function in the other hand. And the idea is, okay, if you cut the sensory stimuli, he still has the motor function. He can still move the hand. And actually what he started seeing, that actually the apes stopped using the hand. They weren't using the hand, that the area of the sensory stimuli was cut off. And then he decided, okay, the next stage we'll do, let's cut it on both sides. And when he cut it on both sides, because they had they had to start moving the hand, otherwise they couldn't eat, they started moving the hands, even though there's a sensory stimuli. And then when they recorded in the brain, they saw that the brain changed, that certain areas of the homunculus, you have the motor and the sensory homunculus, changed to overlap those areas that had been damaged. And then certain areas became what wired together, fired together. The same idea was occurring in the idea of the phantom limb pain, that when you have a damage to a certain area, a sensory stimuli, you have an amputation, your brain still reorganizes itself and still sends out stimulation of pain, for example, because the brain remembers that. And the mirror therapy, the researcher that developed the mirror therapy actually found out that when you use the mirror therapy, it's the idea that if you have a, let's say, amputation of the hand, you put your opposite your damaged hand, like kind of in a mirror, and you put your healthy hand on one side, and you look only on the healthy hand, and then actually the brain actually adapts to the idea. It says, okay, I shouldn't be sending out a signal of pain. But in that research, he also found that actually the brain was reorganizing itself. So in the idea of neuroplasticity, the idea is that neuroplasticity happens in 3 stages, basically. The first stage is actually when chemical secretion, and that's where I think acupuncture works. especially scalp acupuncture. What happens when you have a chemical stimulation, then that's actually sending out a message to different synaptic areas and trying to start connecting them. So that's the first stage. And that's why when you, for example, juggle or you're learning a new motor function, as you practice in that hour or 2 hours or 3 hours, you go and improve. And then what happens when you go back the next day, you actually starting from 0 again, or you could say 0 plus 1 or plus a half, and slowly it goes and improves. Because the chemicals started making the connections. That's why you improved. But it's only chemicals. There's no connection between the two, between the nerves. And slowly, as time goes on, the second stage it happens is actually you have proteins that start connecting. And actually, what happens, you have the brain starts reorganizing it, and the synaptic connections start getting more enforced and stronger together. Okay? That's the second stage, and that happens that already once you start doing the motion, already the nerves start firing and the connection. So you could say, I'm doing this, there's a secretion, and slowly, as time goes on in practice, you start connecting, and that's already the proteins have changed in the synaptic connections, and there's a stronger synaptic connection. And then the third stage is actually what's called what wires together, fires together, and that's functional. It means as I start doing a certain motion, automatically all those neurons fire together and they strengthen the connection, and then you have a fluent or better movement. So actually, when you're doing a motor function, for example, also what's important is also the sensory stimuli. That's why when you do acupuncture as well, when you even insert the needle for the dachi, for example, around the nerve, you actually want to cause that dachi of a stimulation so the brain remembers that area and gets, okay, a vibration of sensitivity from that area and say, okay, this area, we can use it. So that's the first principle. Wires together, fires together, positive or negative. In our case, we're looking at the positive side. So what I believe is actually what we see in acupuncture, scalp acupuncture, we actually enforcing the chemical connection. And when we do manual practice at the same time, we actually strengthening those connections more and more and more. So this is why Zhu says scalp acupuncture is like opening a lock. It's actually opening the lock and making more chemical connections. And then walking through the doors that manual therapy, or what he calls Darwin. Okay, so that's the first function. So that's the first principle. And that's the main principle we're working with. But we also have to take into account when we come into the patient, we have to know, I know when we study, we have to know the Shen, Jing, and Qi. What is his level of the Shen? What is the level of Jing? And what is Qi? So you could say Shen is what his mental state is. Okay, or the Yi in some way. Is he on board with me? Does he want to work with me? Okay. If he's, for example, tired and he's not with me, then it's going to be more, I have to work on his mental state to try and improve the mental state. And not necessarily I'll do that with scalp acupuncture. I might use acupuncture for it, or herbal medicine, or even talks and into a psychiatrist to actually put him on board and try and show him his small successes. And sometimes when you do that, for example, the scalp acupuncture, suddenly he says, oh, it's easier for me to move the hand. And even if you have that idea of placebo effect, you're already affected the Shen in some manner, and that gives them the energy. The next is the Jing. Okay? The Jing is, what are my reservoirs? What do I have to work with? If the patient, for example, is he has no reservoirs, and he's actually abused his body throughout the years, and the reservoirs are empty, you have to fill those reservoirs somehow. So that's also important. What do I have to work with? Or if he's depleted, or, for example, patient, for example, that's come out of a severe stroke, and now for a period of time, you need to work on building that Jing somehow to have something that you can work with. Or you can even, your prognosa, if you see there's no reservoirs, your prognosis is not going to be good. But if there are reservoirs, you say, okay, we've got something to work with. And the next is Qi. And the idea of Qi is, do we have Qi to work with at that precise moment? So a lot of times in the technique of the scalp acupuncture, before I apply scalp acupuncture, I like to build up Qi. So I have Qi to work with. You got to think of the idea that in scalp acupuncture, we're working with something very, very yangi, okay? Yangi in all the ideas. Yang also for acute problems, the idea of acute. and we want to get a result fast now and fast, because we have that idea. If you don't use it, you're going to lose that function. And if you stimulate it faster, you're going to get it back as much as possible. So that's also important. So when I don't have chi, of course, we're not going to have too much of an influence. And then we needle in the most youngest part in the body, in the scalp. So the idea is, in many cases, before I start working with scalp acupuncture, I build the chia. Okay, it might be with a herbal remedy. Okay, very basic herbal remedy, a lot of moxibation. Okay, or so I have chi to work with. So that's another context. But the idea is not only on the patient, but also on the practitioner. If I'm coming into the clinic and I never slept well and I don't have chi, it's going to influence the patient. I won't be correcting my needling. I won't be patient with the patient. I'll say, oh, I want the result, and I won't be attentive to his thought, to what he wants. So it's also the practitioner, and has to work on these 3 levels. Okay, so the idea of Dao Yin, okay, and if we take the idea of Zhu, I like taking Zhu and I put it into Yamamoto because it's also very important. Dao Yin means to harmonize the chi and soften the body. So if you, for example, take a patient that's had a stroke, for example, his body, there's a lot of stagnation. Might be wind, okay, but the patient is stagnative in some manner. It does, or flaccid, okay? A lot of times what happens, if flaccid, certain areas start to develop spasticity, and then we have this something that's got stuck. Okay, but in a lot of the cases, I found that a lot of them are not only flaccid, but they develop some type of spasticity, and there's also for ataxia. And the idea is you want to soften the body and turn it like soft clay that you can move the chi from place to place. And that can be done with massage, body acupuncture, with even techniques that you give them, and acupuncture itself. And that's what's important, because once the body is harmonized, or the chi is harmonized, flowing correctly throughout the body, and the body is softened, the chi can flow very, very easily to every way. Think of a flute. If you have a clogged flute, then it's gonna you won't have these nice sounds, okay? And if you open up the holes where they clog, then it's going to have a harmonical sound throughout the body. And that's the same idea. They speak a lot about it in Tai Chi. They speak a lot about it in Qigong. They speak a lot about this idea in yoga, all these ancient Eastern medicines. And even today, they speak a lot about this importance in the West. Okay, so I like to divide the idea of Dao Yin into 2 sections. One is active Dao Yin. So active Dao Yin is any active movement the patient can do, okay? I'm not influencing it. So for example, active Dao Yin is any movement, okay? Any movement that the patient can do, that's active Dao Yin. Even a passive movement, when I move in the patient's hand, but the same idea, he's feeling that movement of the hand, for example, that's also active Dao Yin. Also mental stimulation. Mental stimulation is also the idea of meditating and visualizing and imagine the function. For example, if a patient has paralysis for the hand due to a stroke and he can't have the motor function, so I can go tap the hand. So remember, the sensory stimuli is important. I can do cupping. Okay, just get the chi flowing into the hand. But at the same time, what I want the patient to do is start imagine himself moving the hand or feeling the hand move. Okay, and in some cases, when they totally paralysis, what you want to do is also try and breathe to that area. So that's more the idea of active doing, and it works. You'll see that you put in a needle and there's no change. And then you ask them, okay, let's visualize and try and breathe in an area. And suddenly, even a slight twitch or slight movement starts in there. And that's an amazing change of the patient's mental state on the shed. Okay? And then we have what's called passive doing. Passive doing is actually, I'm influencing the patient. He's not doing anything. And I'm something externally is influence in the movement in the body, the movement of the chi in the body. One of them is acupuncture, because once you insert, the patient doesn't put in needles. I put in the needles, and the chi starts flowing into the body. That's passive doing. And a massage, a body massage, a cupping, something externally is doing that. I'm influencing on. So you combine these 2 techniques together. So when you do the acupuncture, you're actually doing the passive idea of doing. Okay. So just for in general, there's many types of modern types of Darwin. So the idea is, like I said, we only in one part of the puzzle when we have a motor function, for example, that's being damaged, okay? And we want to influence that area, okay? But we want him to walk through the door because we're going to open the lock, we're going to make more chemical connections. And in the long term, might take a couple of months, we're going to get a very strong effect on the patient. And that's why we wanted to do these exercises himself, okay? So one of them is relaxation, or what's called or visualization, or mindfulness. That's physical exercise, speech training. One of the things that stimulates the brain the most is learning a new language, especially if you have a patient that might have a cognitive disorder, or his memory is being impaired. The best way to stimulate their brain is to start learning a new language. Might take time, but that's because a lot of areas in the brain, the memory area comes into account, the motor function comes into account. So you have muscles that are contracting at the same time, the sensory stimuli. So you have a lot of areas that stimulate the brain, and that's very, very good for learning a new language, to try and learn a new language. Okay, the next is any functional massage, yoga, qigong, adjustment therapy, dancing, singing. The idea is to get him into a course of being active. So for example, when a patient sometimes, it's a thought you need to take into account. I know I had a physiotherapist here in Israel that what she started seeing, she was working in rehabilitation for a lot of years. And what she started seeing, that patients, when they leave the rehabilitation center, they kind of, like I said, they don't want to be seen in public anymore, and they actually go and deteriorate. So what she started saying, said, okay, I'm offering now, not you can do it, you can do it other ways. I'm offering free physiotherapy exercises to all patients that had a stroke on one condition, that they have to volunteer. They have to volunteer somewhere. And the idea of volunteering is that they'll be social engaged and have some activity and not be reclused in the home. She's done it for a couple of times, but unfortunately it doesn't work. You have to somehow make an income. But that was her idea. She tried to open an organization, but it never worked. But it was a very amazing idea, whoever can do it. So the idea is to get them function. So that's basically what we're trying to do, is to think that we want part of this puzzle. So when you go into your clinic tomorrow, for example, if you have a patient that's undergoing some neuro rehabilitation, you have to start working with him in those manners. The same idea is that today also if we just speak about pain, because a lot of us have a lot of patients with pain. Also, the idea of pain, there's no organic reason for the pain. They started to understand that pain sometimes can put an imprint on the brain, and then for the rest of the life send out a signal of pain and they don't idiopathically, they don't know why they have the pain. So even that is to start with the patient, to start thinking positive, how he lived his life without pain, before the pain, to try and bring him out of that and start being aware when the pain starts appearing. Even if you get into very good levels of meditation, sometimes you can even concentrate and start seeing that this pain, for example, feels all over the hand, suddenly it only starts coming from one point, was the idea. And once he managed to pinpoint where the pain is, and he can put his concentration on that, it will change. That's the constant thing, constant change in the brain. Atoms move, atoms come, atoms go, and the same thing. That's the only principle that in life that we constantly change it. And the same idea of pain, and the idea of motor function, because that's what we want to speak about, that when we have a motor function, we want to needle that area. And sometimes it might take 10 to 15 minutes till they start seeing some change. But once there's even a slight change, that has an influence on the patient, on the chemicals there, and then you can start working with them. Sometimes you might have to wait that 10 minutes and then start working with the hand, for example, or the leg. So to sum it up, I want to give you, two areas, especially if you're speaking of a motor function on the hand or the leg. Okay, what we call the isomatotope of Yamamoto. I'm going to go out of my shared screen so you can see me in a bigger screen. Okay. Oh. Yes. Okay. So the idea is, if we go to the area of our ear here, okay, it's always needled ipsilateral, and we have, let's say, from the root of the ear, we have the shoulder, shoulder area, and if we go about 4 centimeters up, right to the superior border of the temporalis in a 90-degree angle, that's the area of the head. So all this of the palm of the head. That means so that that area there is your whole upper extremity. So you can start looking for tender areas there or sensitive areas there, needle it. And at the same time, you can palpate these areas and ask the patient to try and move his hand, for example. So that's one part. The next part for the lower extremities, if you go to the posterior area, you have the mastoid. And you go up from the mastoid, there's a notch here, right? In the upper posterior corner, there's a notch, and that's the area of the hip. And if you go up again, 90 degrees up to the superior border of the temporalis, so that's the area of the foot. So that's your whole lower extremity. So what you can do is, again, palpate there, start seeing if your patient has some movement or some change there in the feeling, even with pain, and then start working with him. And that's what I very much recommend to do. And you'll see it might not take, what happens, you have to expect that it'll have 1 step forward or 2 steps forward, 1.5 steps back. It's a long process, and you have to encourage them to be with you and do the work and give them exercise when they go home. And then you do the exercises when they come back. I'm not a physiotherapist, but I'm an acupuncturist. But when I was working, I'm a sports therapist. When I was working in my first years, and I used to go see patients at home, I used to play around with them. Okay, say needle. Okay, it's easier for you to move your hand. Let's take a cup and start moving the cup from side to side. I have a feeling of trying to drink it, try and feel it. I was doing the exercises in their home. So that's another thing. You motivate them to do the exercise of things that they like to do or they want to do. So for example, a patient says, I want to pick up a pint of beer again or drink a pint of beer. So not necessarily you have to come to the clinic with beer, but even give them a mug, and then say, okay, let's start working on that. And then, or even get the function and practice it at home. Someone wants to drink his tea, or someone wants to, I don't know, whatever comes into their mind, read a newspaper or change the pages of a book. So you work on those things because he's motivated to do it. So if he's motivated, you already got him on board. And now you just got to stimulate him with the scalp acupuncture. So basically, that's what you're trying to do for motor function. So that's it. Thank you. So the principles are very, very simple. We'll speak more, like I said, in the course, we speak more into depth of it. We'll also go over certain diseases. We'll speak about Parkinson's disease. We'll speak of neuroskeletal disorders, how you can, spasticity. We have a lot of things of spasticity we'll speak about. Avi will bring into the idea of neurosurgery, what we can do as well. Not that you might see the patients after the neurosurgery, okay? But that's generally, we'll go into specific disease. We'll go deeper into the palpation, the technique, and etc. I think that's why, Chris, we have a 4th day to go into specific diseases as well in this course.
Yes, indeed. This year you had on a 4th day. So those of you who've done the course previously, you can come back to the 4th day. And those of you who haven't done this, there's a course running in June. I've put the details in the chat, but of course you can always go to the AAC shop and it's there, and there's a discount code as well. I've just put into the chat here. But again, if you don't have that later, if you just log into the members area, there is a discount code in there as well, and the discounts page for that, which takes you about £80 off. So the course is in London, and it's running on the 19th, 20th, and 21st. And then the advanced or extra day, if you want to do that, is on the 22nd as well, which we were really keen on last time when you came over. We had the 3 days, but you kept on dipping into other things, and it was really interesting. So we wanted this extra day just to add those other useful pieces in and clinical experience there that you bring with this course. So I've been trained in scalp acupuncture previously, but I can promise you, you know, David, his knowledge is unbelievable. And I was so, as I say, I was at the beginning when we started, I was just listening for a few hours before I had to go. And it was frustrating that I had to leave. I was almost holding on to every minute just to get some extra knowledge. So I'll be there this time and see anyone who's going this time. So do you want anyone want to ask any questions in the chat, or you can take your microphones off and ask David anything that's come up? I mean, you've done such a good job. Everyone's you explained it perfectly. Obviously, there's no questions. Great. Well, thank you very much, David, for your time, and hopefully we'll see you all on the course in June.
Thank you, Chris. Thank you all for coming. I don't take it for granted that people come to listen, and I hope you found things that you can use tomorrow already in the clinic or during the week if suddenly you have a patient with a stroke or Parkinson's or MS. But the general idea, remember what wires together fires together, and if you use it, if you don't use it, you'll lose it. These are the two main ideas you need to keep with you. So thank you very much. Have a good evening.
Very much.
Thank you.